all, just again, thanks for agreeing to do this testimonial here for us. So I always wanted to hear patients' feedback from the things that we do. So first of all, I wanted to hear how did you hear about us, and what kind of prompted you to come see us?
Well, I did some research on my own after work with my main body guy, chiropractor, kinesiologist. It wasn't really getting to where I felt like I was improving at all, kind of like plateauing. So I had heard about plate and plasma therapy, and he hardly endorsed it and said, Rob, it's something unique because it's not going to heal itself. So then I started doing research on what clinics have the most successful or extensive treatments. And I believe yours is one of only 9 in the country that does it the exact same way. So I said, I believe the interview I had Friday, I said, I want to do it Monday. And I was all in, and it's been great ever since.
Awesome. So before you came to see us, what kind of symptoms were you having in the shoulders?
Right. Well, I do very strenuous workouts, and I work long days, 13-hour days. And I had some old injuries from training, HIIT training and weight training. And I didn't realize how much discomfort I was in because I wasn't used to feeling zero pain. And then when I had the partial tears of both tendons, supraspinatus tendons, I couldn't do anything upper body.
Wow.
And I said, I got to do something about this. I was using a blue light blanket with heat, which helps circulation, but none of it really, improvement was marginal.
Okay. Yeah.
And then your clinic was highly recommended.
Good.
And so it was strictly on my own research.
Awesome. And then the procedure itself, what do you think?
Oh, the procedure, I mean, I was a little taken aback. I thought it'd be in like a regular exam room, but it was almost like an OR, and it was very professional, and you had machines beeping, and you had nurses there, and everybody was dressed, and yeah, it was, to me, it was very easy to go through.
Good. Yeah.
And I didn't feel much.
Good. And how you are now? We're at what, 3 months post procedure?
We're at 3 months.
Yep.
And the left shoulder tendon is normal.
Good. Yeah.
Pre-injury normal.
Excellent.
0 across the boards on the pain and movement and mobility and things like that, everyday chores. Whereas before, even before the main tendon injuries, things like, I didn't realize, things like putting an arm in the sleeve of a coat.
Yeah.
Painful.
Wow.
Or putting on a backpack.
Yeah.
Painful.
Simple things.
Simple things.
Yeah.
Now it's just like nothing.
Yeah.
And this arm is probably, after very hard workouts, it's maybe a 2 localized muscle on the muscle.
Yeah.
But I have no restrictions whatsoever, and I have no fear of any type of injury or movement with any type of workout I do.
That's awesome. What I'd like to hear is anything else you want to add?
Well, I highly recommend that you don't base your choice of treatment on out-of-pocket costs, because to me, there's nothing more important than quality of life. And to be in pain or discomfort, you have to be willing. It's an energy exchange, and like, I'm so glad I did this, and I would definitely, if the need came up somewhere else or whatever the case would be, I would do it again, and I highly recommend it.
Absolutely. Well, thank you so much, Mr. Stoll. I'm glad
Thank you, Doctor.
that you did really well.